Operation Walk is a private, not-for-profit, volunteer medical services organization that provides free surgical treatment in developing countries for patients who have no access to life-improving care for arthritis or other painful and debilitating bone and joint conditions. In 2006, Dr. Cecil Rorabeck and Dr. Bob Bourne assembled their first international team of Operation Walk Canada volunteers and flew to Antigua, Guatemala to perform hip and knee replacements for a population with virtually no access to procedures that are taken for granted throughout North America. Based on the desire to make a significant difference and lasting impact, Operation Walk Canada has made a commitment to the people of Guatemala to return each year to Hermano Pedro Hospital so that the exponential benefits of these surgeries can be realized by a focused group and that their efforts can be both enduring and measurable. It has been possible for the team to return to Guatemala each November since 2006 because of the outstanding support from a host of sponsors and volunteers. Smith & Nephew has donated all implants, and other corporate and individual donors have made it possible to fund infrastructure upgrades, such as the installation of air conditioning and patient monitors for hospital ORs. Operation Walk also fosters improvement of the host country's healthcare system by teaching and sharing knowledge with in-country medical professionals. Operation Walk Canada operates by responding to invitations from in-country physicians. They build teams of volunteer healthcare professionals who are experts in their field. In the spring of 2010, the London team was asked to assist with the treatment of a population of patients in Ecuador with a serious condition known as acetabular dysplasia. It results from untreated hip dislocations, prevalent in the country due to the age-old practice of swaddling children at a young age. In countries like Guatemala and Ecuador, very few people have the luxury of transportation. That reality, coupled with a high, manual labor-driven society, means that the need for mobility is critical for subsistence. Without a public health system that supports such treatments, and with procedure costs well in excess of average annual salaries, many thousands of people are left to suffer without relief or hope. In the year prior to a mission, Operation Walk Canada works with sponsors and supporters to secure all the necessary equipment, soft goods, and medicines needed for the upcoming mission. An all-volunteer team of more than 40 medical professionals is assembled with specialties based on the target condition to be treated. One team recalls how the conditions in Guatemala were worlds apart from the level of need and care that is taken for granted back home. Upon arrival, they were faced with wards full of infants with severe conditions. Children lined the hallways in the permanent care of hospital staff, and hundreds of people lined up every day at 6 in the morning for the chance to see a doctor. With a limited, precious few days, the first task is always to decide who they'll be able to help. Some people travel for as long as 14 hours in the hope of receiving these life-changing procedures. Families wait anxiously for their name to be called, their chance.
Ana Cristina Andrino.
For instance, this young farmer, Carlos, was left unable to walk or work to provide for his family after a severe tractor accident went untreated. Operation Walk gave Carlos a new knee and the potential for a vital future.
That is really amazing.
The impact from such missions is profound. Operation Walk Team Canada may perform as many as 70 joint replacements in a 6-day mission in Guatemala, a figure that represents a third of the total such procedures done in the entire country in a single year.
Gracias. Que Dios les bendiga.
Operation Walk Canada continues to provide life-changing procedures with the generous support of volunteers and sponsors, making a difference one step at a time.